Welcome to the Thames Valley Cancer Alliance Health and Wellbeing series. At the Alliance, we work with colleagues across Buckinghamshire, Berkshire, Oxfordshire and Swindon, and our sessions are developed and delivered by health and wellbeing professionals from NHS trusts and wider providers who work with people living with a cancer diagnosis. Today I'm joined by Elsa Robson, a specialist dietitian from Buckinghamshire Healthcare Trust, and Elsa will be talking today about taste changes in cancer that you might be experiencing, and she'll go on to talk about some of the things that you can try to improve your satisfaction around eating. These sessions are for you. We want to bring you information that helps you to live with a cancer diagnosis. We also hope these sessions are helpful for friends and family who are supporting someone living with and beyond cancer. If you find this video helpful, please like it and subscribe to our channel so that we can bring you the latest in our health and wellbeing series. Elsa, thanks for being here. Tell us who you are and give us a little introduction on what you'll be talking about today.
Hi, my name's Elsa Robson. I'm a Macmillan Community Specialist Dietitian. I work in Buckinghamshire Healthcare NHS Trust. As dietitians, we're often supporting people that have significant taste changes related to cancer and its treatments. For some people, this can be short-term, unpleasant, but temporary, and it doesn't necessarily have a massive impact on day-to-day life. For others, however, it can be long-term. It can have a really significant impact on somebody's ability to maintain their nutritional status and impact on their overall quality of life as well. So this discussion will outline various different aspects of taste and flavour, a bit about the biology of what usually happens. We can talk about taste changes in cancer and why they happen, and then a bit more about what can be done to help.
Elsa, can you give us some background on how taste works? So how do we taste and what's going on when we eat?
Thinking about what taste is, the physiology behind that, I'm going to talk about a bit of the biology behind what happens when we actually eat something to what sort of senses and feelings that produces in us. So if we go back to what the different senses are initially, because taste is one of the 5 traditional senses. The first one would be the smell. So with food, that would obviously be the smell of food, the sight of food, the touch of food. So that might not necessarily be the touch if you're actually handling food, but actually the sensation and feeling of food in the mouth. So whether the feeling is of something that's a rough, crunchy food, or if it's quite a soft, moist food, and that will all lead to the different sensation of taste. The sound of food. Food can make different sounds as well, and obviously the taste is the final 5th traditional sense. And so all of these different elements and all these different senses all contribute to the overall experience of eating. So if we concentrate maybe a little bit more about the taste of food and how we actually taste food, this begins with chewing of food. This releases chemicals in the food. These chemicals mix with saliva, and this saliva also starts the breakdown of food. As you can see in the diagram, what then happens is this mixture of food and saliva comes into contact with the taste bud. These taste buds have taste cells underneath them within the skin layer, and that might be on the tongue or around the sides of the mouth, in the cheeks, and also towards the back of the throat as well. There are also taste buds in all of these different areas. On your tongue, there are between 2,000 to 5,000 taste buds, and different people have different types of taste buds, and that's why we all taste foods in a slightly different way. Within these taste buds, there are also different cells that pick up the main tastes, and we'll talk a little bit more about that later. There is a misconception that different parts of the tongue pick up different tastes. So if I say, for example, it was always thought that the tip of the tongue picked up the taste of sweet food, but what we actually know now is that all of the taste buds contain all of the different cells that are able to pick up all of the different tastes. So what then happens is that when these messages about taste are picked up by these cells, messages are sent along nerves to the brain. The brain then makes sense of all these messages from all the different taste buds. It also combines all the messages from all the other 5 different senses. These are then combined with past experiences and memories of foods that have been eaten in the past, and that gives a response. Thinking about the response that we then feel into eating something, you can think about this in 3 different ways. So there can be the sensory response. So that's what the actual flavour is. So that's your perception of the taste and flavour of the food. There can also be a physiological response. So that might be, say, for example, if it's a nice taste and something that you're enjoying, the physiological response to that will be a production of more saliva and other hormones as well, and messaging systems along with that. And then there's also the emotional response to eating food as well. So how we feel about eating that food. So hopefully that's given you a flavour of what usually happens when we eat food and how that response to taste happens in a biological way.
Can you tell us a little bit about the different tastes and flavours that we experience when we eat?
So there are 5 basic tastes that those taste buds and taste cells are able to pick up. They include sweet taste, sour, salty, bitter, and the newer taste is savoury or umami. So just thinking about what these different tastes are and what types of foods you get those tastes mainly from. So sweet foods, I think we'd probably all be familiar with what tastes sweet. So this would be something like sugar, golden syrup, honey, jams. A sour taste that we would be able to perceive, this would be a sort of acidic taste really. So perhaps something like lemon, pineapple juice, vinegar and yogurts. A salty taste, obviously this would be things like any type of table salt, sea salt, and soya sauce is also very salty. And then bitter tastes come mainly from foods that have cocoa powder in them, citrus peel, olives, tea, coffee, and also tonic water has a very bitter taste. And then the umami taste is a savoury type of taste, and this comes from foods like soy sauce, cheese, gravies, mushroom, and Marmite. And so we can use this information if we have taste changes to think about what tastes good to us and perhaps what also tastes bad to us as well. And we can think a little bit more about the impact of this and how we can help taste when taste changes.
Can you explain why taste can change for people who have a cancer diagnosis, and maybe talk a little bit about how long those changes might last?
Thinking about how taste changes in cancer and why that happens, in actual fact, we don't completely understand why this happens. We do know that there are some factors that are involved, and these might include, for example, the site of the cancer. We know that people who have head and neck cancers more frequently have changes to their taste, and that may be a result of the types of treatment that they have and where the cancer is within those areas. It may be related also to the chemical changes that happen when you have cancer. So having cancer changes a lot of our hormonal responses and a lot of chemicals that are produced within the body. And many of these chemicals do send messages to the brain, and therefore they can interrupt with some of the taste messages that are going to the brain, and therefore change our taste perceptions in that way. The other thing that can affect our taste are the different types of treatments that you may have when you have cancer. So these treatment effects can last for hours for some people only, perhaps days. So for some people it may be just a few days after they've had chemotherapy. For some people it can have more long-lasting effects, perhaps for months. Others it may be years before their taste returns, and for some it can be permanent. So it's quite variable really in terms of the impact it can have. We know that about 76% of people having treatment for cancer report changes to taste, and 45% reporting a change to smell. So it is very commonplace, and a lot of people have changes to taste and smell when they're having treatment for cancer. The treatment effects, there's some information and research about why this happens. In chemotherapy, it's thought to be due to damage to some of the rapidly dividing cells. So some of the cells within our mouth and our mucosal membranes rapidly divide, and when this division is stopped when we're having chemotherapy, it can lead to changes in smell and changes in taste. There may be also other medication interactions, and however these are usually short-term and temporary, and as the medication is out of our system, then the taste can return. Other treatments, say for example with radiotherapy and surgery, again these can be short or long term. However, for some people who have had cancer of the mouth or the tongue or the esophagus, sometimes after this surgery the side effects can be longer term.
So as you've said, these changes can be different for different people. Give us some examples of how people might experience those changes.
So yeah, there are different types of taste changes that can happen for people, and people experience these and talk about these in different ways. So for example, this may be a loss of taste. Often people would describe this and say everything tastes like cardboard. This may present also as a reduced sensitivity. So somebody may say, oh, I feel like I need to add salt to everything now to give it some taste. It may present as an increased sensitivity, so they may go off certain tastes and flavours. So, for example, if somebody has gone off bitterness and they find bitterness very difficult to tolerate, they may say, oh, I've completely gone off drinking coffee. There also may be changes in taste. So certain types of taste have been heightened or dampened down, and this can manifest in people saying things like, oh, meat tastes very metallic, or there's a certain taste that's coming through. And also people can have changes in temperature sensitivity as well, so people can be more sensitive to either very hot food or very cold food, and may say things like, oh, very cold ice cream just makes me shudder. So taste changes can present themselves in lots of different ways.
And is there anything people can try that could help the effects of those taste changes to improve those eating experiences, make it more enjoyable?
So there are definitely things that we can do to help in terms of managing taste changes. It does tend to be a lot of trial and error, and not one thing will suit everybody. There are key things to consider and to think about. So one of those is taking care of your mouth and your teeth. So in order for the taste buds to be working as effectively as possible, it's important to keep your mouth and your teeth clean. A lot of people do experience a dry mouth and perhaps a lack of saliva. So from that point of view, to optimise taste, it is important to keep your mouth as moist as you can. If there's something that's particularly troublesome for you, you may want to consider accessing an artificial saliva of some sort. You can get these on prescription from your GP, and they're also available to buy over the counter as well from any chemist. So in terms of also maintaining moisture within your mouth to help with taste, ensuring that you're having adequate fluid intake as well is important. So for example, this might be between 8 to 10 glasses of fluid a day, and this can be any fluid, so it can be from tea, coffee, hot drinks, cold drinks, water, squash. It doesn't have to be just water. In terms of other things that you can do to help, as well as looking after your mouth and taking care of your mouth, then the other aspect is sort of experimenting, I guess, with different tastes and flavours, and trying to identify which tastes and flavours perhaps are actually tasting really bad to you and which ones are tasting better, and trying to change that and experiment with different tastes and flavours. It can be quite a bit of trial and error, and often people find that they'll think, oh, I'd really fancy that, I really would like that, and actually when they make it, or you know, they have somebody who's a carer for them who makes food for them, often then they may get it in front of them and they think, oh no, I just can't stand it, or you know, perhaps even their tastes have changed by the time they get to eating it, and that's very common. If you find that only perhaps a few foods are affected, you might find that you can just avoid this food and it doesn't have a major impact on your nutritional status, and perhaps then you can just try that food again in a few weeks' time to see if the taste of it has changed. If it is a food that you're eating regularly, you may perhaps need to look for an alternative. If you're finding that actually your taste is severely affected and you're unable to eat and you're getting very little pleasure from food, and it's then leading to weight loss, if you're finding if this is the case for you, I would suggest making sure that a healthcare professional is aware of this and they can offer additional support. So say, for example, that might be your oncologist, that might be a clinical nurse specialist, maybe your GP. So when we're thinking about how to manage taste and taste changes, there are things that we can do and we can think about in terms of balancing tastes and flavours and also enhancing tastes and flavours. So where this might be helpful, say for example with sweet foods, if you're finding that everything is tasting overly sweet and this is making them unpleasant to eat, you could think about balancing the taste of that sweetness with sour foods. So say for example with a salad dressing and salads, if it's tasting too sweet, you could add extra vinegar and that will help to balance the sweetness. And also if you're actually quite liking the sweet flavour and you're wanting to enhance this flavour, that can be done through adding salt. Say for example things like salted caramel may be more acceptable for you if you're liking that taste. So say, for example, with sourness, if you're finding that food is tasting overly sour, you can balance this with sweet, bitter or spicy foods. So say, for example, by adding jam into yogurts, adding sugar in tomato sauces. So where that sourness from the tomato or from the yogurt is overpowering, you can balance this by adding sugar. Also sourness, if you're liking the taste of sourness, then this can be enhanced with sort of salty foods or umami foods. So say, for example, in a sweet and sour sauce, you could add soy sauce, say, for example. Again, for salty and savoury foods, they can be balanced with bitter or sourness. So say, for example, adding balsamic vinegar to roasted broccoli, and that can help to change the taste and flavour and make it more acceptable. And also these salty foods can be enhanced with sweet foods. So, for example, adding sugar into savoury food can sometimes help to manage that taste and flavour. Again, with bitter foods, these can be balanced with sweet, salt and umami. So, for example, the bitterness of Brussels sprouts can be balanced by adding something like a sweet barbecue sauce. Lots of ideas here. There are also lots more ideas and information about how to balance and enhance flavours and tastes. And this can be accessed through the information leaflet that's also available. So there are other things that you can consider to enhance really the overall experience of eating when we're thinking about the different senses that are involved in the experience of eating that we've already talked about. You can think about how you might be able to manage these to also improve the taste and overall experience of eating. So this might be, for example, thinking about what food looks like. So that's obviously sight is one of the other senses. So trying to make food look as appealing as possible. And that may be just as simple as ensuring that you have different coloured foods on the plate. So that, say, for example, you don't have chicken with a white sauce and mashed potato, which are all foods that look very similar colour. That can be less appealing. So adding in different colours to try and enhance the look of food. Also considering the sense of smell. Sometimes for people, actually, cooking smells can be very off-putting. And so in this case, thinking about cold foods, and if cold foods may be more helpful because cold foods smell less and therefore it may be more appetizing for somebody if foods smell less. And then there's also the sense of touch as well. And there are a few different elements to this. So this may be thinking about the temperature of food, whether hot foods are more appealing or cold foods, or for some people it may be actually combining different temperature foods together. So say, for example, having a hot apple pie with cold ice cream. Even if you're not able to taste the difference between those two different foods, you may be able to sense the temperature difference, and so you're getting some feedback and it's giving some interest to the food that you're eating. The other element to this is also, in terms of the sense of touch, is the texture of foods. So again, combining different textures of foods can help to make food more appealing. Also adding spice and heat. I guess if you have side effects like mouth ulcers, then this wouldn't necessarily be advisable, as it may irritate those mouth ulcers further. However, if you're able to tolerate spice and heat, then adding different herbs and spices to meals and to food can help to enhance the flavour and taste and give it a different taste and make it more appealing. Again, there are lots of different ideas for herbs and spices and how to use these in your cooking and food preparation in the leaflet as well, that's also available. The other aspect also is considering the use of fats and oils, and that's because the chemical compounds that we talked about interacting with taste buds, if there are fats and oils also combined within that food, they stick to the taste buds for longer. So if you have an absence of taste, this can be helpful because it can help those compounds to actually interact with the taste buds for a longer period of time. So there are lots of different things that you may want to consider. And again, as with all of the aspects of taste and the experience of eating, it will be trial and error.
Is there any medication that people can take or vitamin supplements that help with the effects of taste change?
Thinking about what other treatments or other medications might be available. In terms of having an impact directly on taste, there aren't any specific medications to treat taste changes yet. There has been some evidence, although it's very weak, in scientific studies that look at different mineral deficiencies and taste changes. One of these in particular has been zinc. Zinc is a mineral that is found in meats and shellfish, dairy foods, also bread and cereal products. People who may have a very low intake of zinc, maybe perhaps people who follow a very strict restricted diet for whatever reason. If you are concerned that you may be zinc deficient, you can ask for a zinc status blood test. That is possible to assess whether you have a zinc deficiency. However, anybody who has a normal zinc status, it's unlikely that this would have any impact on your ability to taste. There is also evidence about taking large amounts of zinc supplements when you don't need it can also affect the absorption of other nutrients, and that can lead to further imbalances and anemia. So it's not recommended to take a zinc supplement unless you need to because you're deficient. However, there isn't any evidence of harm of taking a multivitamin and mineral supplement. So one of the A to Z multivitamin mineral supplements that you can buy over the counter that isn't particularly high in any one particular mineral or vitamin is perfectly safe to do if you choose to do that.
Any final thoughts for our viewers today?
So I guess sort of the overall summary is that everyone is different. When it comes to taste changes, they will be quite individual, and it does end up being a lot of trial and error and finding out what suits you best. It can be a very challenging time for people when their taste changes. We all know that food and eating is a big part of many of our lives, and whether you're the person that has the taste changes or perhaps you're a carer that's supporting somebody with taste changes, because we spend a lot of time either shopping for food, cooking and preparing food, eating food, clearing up after eating, doing the washing up, whatever it is. Actually, food and eating is a big part of most of our lives. So don't underestimate the impact that this can have, and also be kind to yourselves as well, and realise that actually sometimes you can try the best that you can, and that's the best that you can do, and that's the main thing. Thanks very much for listening and watching this today. I hope you've been able to take even something small away that might help you.
Thank you very much, Elsa. We really appreciate your time today. Thank you. And thank you for watching. We really hope you've enjoyed Elsa's talk today. If you look in the description for this video, we'll include a link to the leaflet that Elsa mentions, which includes recipes and ideas for things that you can try. Please leave some feedback in the comments. We'd love to hear your thoughts on this talk and also on subjects you'd like us to bring you. To find out more about the Thames Valley Cancer Alliance, please visit our website. Details are in the description for this video. You can join our mailing list and also find information on how you can get involved with the work that we do. Thank you again, and we look forward to bringing you more of the information you want to see.